name's Kenny Fraser. I'm the CEO of Triscribe. Triscribe is developing analytics based on hospital ePrescribing system. I'm here today with Slee. Anne is one of the leading digital pharmacy and most respected digital pharmacy authorities in the UK. She also happens to be a co-founder of Triscribe. That actually sounds quite scary when you say we don't really know how we're using medicines in hospitals. Luckily, I'm not in a hospital at the moment, but it does makes me a little nervous. So it sounds like there's a big safety agenda there as well. What's happening on that agenda at the moment?
So the World Health Organization has just launched the third Global Patient Safety Challenge around medication error and reducing the incidence of medication error. And what we know when we start to look at the work that's coming out of some of the international research at the moment is that there are opportunities to reduce the risks of medication error that digital systems will help us with. But we don't fully understand exactly how that can be the case and how we can monitor and manage that without that information that we'll pull from the analytics systems. So if you think about very simple stuff around antimicrobial resistance and so on, having some really key indicators and markers of exactly how we're using these drugs will be key to helping us understand how we actually manage better the resource that we've currently got with those agents.
And we were talking about this yesterday, and you were showing me a really scary document with about 80 different
indicators,
things on it for patient. How does that fit with the context?
We know that there are a number of high-risk medicines that we poorly use and create very high-risk issues for patients. And we also know that there are around about 80 indicators that we can use to demonstrate how systems are reducing the risk and incidence of medication-related error. But to do that, what we need to do is report on those routinely and regularly to ensure both that we've optimized our systems to maximum benefit, but also that we're delivering the systems and services around them to deliver those benefits. So those 80 indicators form a core part of the sorts of things that with this sort of information we can start to track, analyse and improve systems as a result of it and patient outcomes following that.
And I think when we were talking about this yesterday, you were saying there's maybe about 20 of those that Triscribe could just do the regular tracking, reporting pretty much automatically.
So there are some very relatively simple ones that we currently can't track and trace that we could report on a regular basis and actually show how over time, when you start to change your systems, you can reduce the incidence of error for individual patients. Whether it's very relatively simple stuff around some of the anticoagulant use that we know at the moment is not brilliant, whether it's some of the incidence of poor prescribing around thromboprophylaxis. So there's some very simple things that we can do that will have very big impact in terms of patient outcome. Currently not possible without very long-winded manual paper collection.
So much easier, much faster.
It means we can put the basics in place and we can track what's going on and focus our efforts in areas that are likely to deliver longer-term benefit.